All right, so good afternoon again, everyone. Welcome to our MedTech talk. So we're joined with Dr. Jonathan Noel. So he is a surgeon with a strong interest in advancing surgical innovation, minimally invasive techniques, and the integration of emerging technologies into patient care. His aim is to help introduce modern surgical platforms, enhance surgical training and capacity across the Caribbean region, with particular attention to improving access to services. Johnson is passionate about the responsible implementation of robotically assisted surgery in developing healthcare systems, and he advocates for innovation that is both sustainable and accessible to the Caribbean context. So thank you again, Dr. Noel, for joining us today, and I'll pass it over to you.
Thanks, Justin, and good to see you. Obviously, you had come to visit us last year, and it was really nice to continue the journey and the conversation a year later. So I don't know if you can see my slides. Everyone see that?
Yeah, see them clearly.
Great. Okie dokie. So I was asked to give a talk on robotics, and I know majority of the audience maybe more from the engineering side, but if you're from the medical side, I welcome any questions, queries. Do push, do ask, because at the end of the day, this only happens when people who are interested in advancing the field, particularly in the Caribbean space, come together and we put our heads together and figure out how to get this done. Because I think we live in a world now that's moving very fast paced and will be further away from meeting our targets in line with other countries if we don't get on the bandwagon soon. And what I can control, what I know about is surgery, and I think robotic assisted surgery is a no-brainer, and it has been for the past 20 plus years, but it's only now coming to the fold. This happened probably a few weeks ago. Guyana was the first English-speaking Caribbean country to introduce a robotic surgery platform. Dr. Srivastava is a Indian cardiothoracic surgeon trained in the US, and I think he is one of the founders of the SS Mantra, which was invested by the Guyanese government, installed in a public hospital, and their flagship procedure was doing a robotic surgery on someone's heart 20,000 kilometers away. The patient was in India with a very geared up team, one that could take over if there was some dropping Wi-Fi or connection issues. But they demonstrated that telecommunication surgery is real, it's here, and it's possible. And I know since then, my Guyanese colleagues have been doing some good surgery with the robot. They're still early days, still in the early phases of learning it, but well done to them. It's a pioneering moment, and it was really great to see. But why does all this matter? Is this just sci-fi? Is this a little bit of ego pumping? I'd like to say no. Innovation isn't always about the newest technology, but in my sphere, innovation should be about improving the patient's experience and the patient's care. That's true innovation. I think surgery done well matters. Surgery done with good quality and safety matters. You can do a big open cut. You can operate purely with keyhole surgery, like akin to using chopsticks with no wrists, or you can use those chopsticks and give yourself wrists with the robot. And it's a no-brainer that the less insult and trauma you have to the tummy, the better the patient recovers. And that's what robotic surgery offers you an opportunity to do. And I think, the transition to an international standard of robotic practice is challenging. It's not to be taken lightly. I think we need to really take pause and think about how this is introduced and why it's being introduced in certain fashions as well. So the exposure to technologies that you all have thus far and will go into as your careers progress, as you take on new challenges, even if you're a post-grad, I think you're doing it because you know that this technology, whatever your passion is transferable in the Caribbean. And to you, it's a no-brainer because whether you're dealing with medicine, whether you're dealing with processes of buying goods, supplies, you want to make it easier. You want technology to be in the fold because you use it every day. Otherwise, why would you be here? But certainly Caribbean training, university training, medical training, I think it offers you a different perspective compared to maybe colleagues overseas. At least that's my experience. You can beg to differ and we can agree to disagree, but there's more hands-on opportunities in medical training. This is a hospital in the countryside in Grenada, and it was here that I decided to do medicine because I was able to perform suturing of a wound at 16 years old. I guess I didn't do the best job as a plastic surgeon may judge, but it really got me involved in how one could use, you know, some skills, some handwork to help treat a patient. So there's a real emphasis on doing in the Caribbean. Maybe that's because of the human resource factor and everyone has to be hands on deck. You have to be adaptable. You have to be resourceful. There's a saying, if you don't have a horse, you ride a cow. That's certainly true in some parts of the Caribbean. But as we all know, we spread our wings, we go overseas, we learn different perspectives. There are a lot more resources in bigger countries, but that doesn't mean that you can't apply those lessons for the Caribbean. I certainly believe so. And just briefly, I was a University of West Indies graduate many moons ago. I did urology surgery training in London, robotic surgery training in the UK up to 2020, and then COVID broke out and I decided to go to Florida for 2 years. And that was the best decision I made because that's really kind of ramped up my robotic experience, and I've been in London for the past 4 years. Essentially, you sit and use a computer and you operate. So you're not really next to the patient, but you see everything within the patient's abdomen to a three-dimensional magnified view. There's a drop of blood, you can see it way before it becomes a problem and deal with it. Blood transfusions are virtually, I will never say zero, but very, very, very low. And that's important, particularly with major surgery. The prostate is a very difficult organ underneath the man's bladder to reach, and there's lots of network of spaghetti-like nerves that are really important for a man's function. And I think if you can tease those off with the beautiful images that the robot provides, then you offer men a much better chance of undergoing the surgery with a good result. But it's not only in my field. Robotics is changing the patient's experience for hysterectomy, women with fibroids, for lung cancer, for head and neck cancer. I mean, the list goes on. And I think the evolution of surgery is how we'll start. We'll understand a little bit about robotic-assisted surgery, and then we'll kind of dwell on the realities of the Caribbean and the future opportunities, and then leave a lot of time for Q&A, which I think is really where we'll get to the meat of the matter, because I think the sharing of ideas is how we'll grow from this. Not to hear me give a didactic talk, but actually to hear from you after my short didactic lecture. The evolution of surgery, as you know, open surgery, and I'm not saying that this is going to be replaced. When I say evolution, I think open surgery is a very good technique, one that we must never, dog and put away. But certainly surgery has evolved to using keyhole laparoscopic surgery, small little incisions, but like I said, using chopsticks to manipulate tissue can be very tricky. And then robotic assisted surgery allows us to do the keyhole or the laparoscopic surgery with a lot more dexterity. And things may change. Maybe robotic assisted surgery becomes natural orifice. You can take out organs through the natural lumens of the patient, whether it's removing a bladder through a female's vagina, whether it's removing an appendix through a patient's mouth. There's certainly lots of ambitious people out there who are trying to make a zero cut on the tummy. So this is an open incision on the left side of your screen, and this is the Da Vinci or the robotic kind of platform, less than a centimeter cuts. And you can see the patient will experience completely different recovery and pain profiles. Most patients who have robotic surgery will end up going home the next day. I often operate on patients on Wednesdays, and I look forward to seeing the new CariSurg cohort on that day. And, you know, Thursday morning, I come in on a train and usually the patient's passing me by going home. And this is something that we need to really demand and ask for in the Caribbean, because languishing on a ward for a week after with complications is just something we shouldn't be satisfied with. So this is the big open cut that happens. You can see the muscles are stretched, etc. Big open hole. And you're looking down in a deep hole, and believe me, it doesn't look like this in a man. It's very deep down, dark, and to try and get a good view of the prostate and do a good job is possible for very few, very skilled surgeons, but not for lots of surgeons. And I think robotic surgery allowed more surgeons to come to the fold and deliver good care. And those who don't believe in robotics and want to bad talk it, you know, don't want more people to come and use it, in my opinion, to allow patient care to thrive. I know that there's a cost consideration, which we'll speak about, but there are ways around it if you become imaginative. Laparoscopic surgery is keyhole surgery. You can see this surgeon holding the keyhole and straight chopsticks. Another surgeon is holding the camera for them, and this is all done by hand. And, you know, look at the natural levers of the shoulder, of the wrist, of the elbow being challenged. Doing that for an hour, 2, 3, 4, depending on the complexity, will ask a lot of you for your career. And most laparoscopic surgeons will have lots of aches and pains by the time they reach 50, which I'm not too far off from. So I would like to work with a good zeal and a musculoskeletal dexterity for a bit longer than that. So I think robotics has really changed that challenge. And this is a table that compared robotics to laparoscopic, which is the first column, and then open surgery, which is the second column. And I'll just draw your attention to that because I think that's powerful data. So robotic surgery compared to laparoscopic surgery had 55% less likelihood of making a big open cut if a mistake happened. So you are 55% more likely to have a big open cut if you do pure laparoscopic surgery. Blood transfusions, 28% less likely with robotics and 70% less likely than open. I mean, in a day and age where, I don't know what it is in other islands, but certainly in Barbados, there's always a drive for people to come and donate blood on behalf of their relatives, their friends. It's an emergency, they're crowdfunding. I mean, this is just not a discussion. And you know, with robotics, you can save the blood bank, a lot of blood that would otherwise have to be used in an emergency situation. You can save it in a planned elective operation. The complications are less. So, you know, if you care about the development of your health economy and how things can grow, how your hospital can deliver better care for other patients in other scenarios, such as accidents, trauma, where they absolutely need the blood, and you save it while delivering good care for patients in other scenarios, then you need to purchase a robot system. And you need to do it yesterday. So why did robotic assistance emerge? Obviously, I spoke about greater precision. What do I mean by that precision? Everyone has a tremor in their hand. That's natural. We know that. A tremor filter technology allows one to have a cup of coffee and have a bit of jitter, maybe do a very complex step, and the arm in the patient with the robot has zero tremor, so it filters it out. Visualization, I mean, the vision is amazing. You can actually see blood vessels as they perfuse by using a green light technology, looking at infrared systems where you inject a dye. And I think the perfusion assessment is something that's underutilized and perhaps needs to be overly utilized. Because if we can see that blood flow is restored when we make a cut and we stitch something together, then that can hopefully lessen the chances of things falling apart or leaking or complications for patients. And then the ergonomics, like I said about the shoulder and the neck, less strain. Everyone should stretch and do yoga and not sit at desks all day without doing some form of stretching and exercise. But certainly doing robotic surgery is a lot better than that previous picture where your shoulders and elbows are all in the air and you're operating like that for hours. There's no way you're not going to get neck pain by doing that day in and day out. And certainly robotic assistance has emerged because now the real complex surgery that required intensive care, head and neck surgery, where your jaw had to be split to get to a throat cancer, lung cancer, where a big cut on your chest wall had to be done, heart surgery. These operations are done and patients don't even need intensive care. They go to a normal ward, go home day 2. I mean, this is an ambition that we should all want, because we are not immortal and something will happen to us or someone we love. And we definitely need to make sure that things are in place for the Caribbean, for them to have the care that they need. So what is it? What is robotic assisted surgery? Surgeon control technology. It's not autonomous. You don't switch it on, walk away and have a cup of coffee, and then come out when a job is done. You do not do that. The surgeon controls everything. It is a medium to allow you to perform the surgery. But it is a team. It's not about the surgeon only. It is a team, a team, a team. This is me sitting at the surgeon console on the left, and you can see the actual procedures happening on the right. You have complete control. The movements are translated into the patient, and that's just the way it goes. Everything is moved. You can see the vision completely. If there's any bleeding, take care of it. I think the vision is something else. And I think it's underexplored. I think there's computer technology that's being looked at with regards to how we view tissue. And it's just the beginning, and it can be further enhanced. This is the patient cart. This is what goes next to the patient. So again, this doesn't function autonomously. You actually have complete control of it. And this is in a very tiny hospital in North Africa, Casablanca, Morocco. They just launched their robotic program 2 years ago. They've done 400 cases. They said they couldn't have, in their wildest dreams, realized what this robot has done for their country and their city. More patients are having surgery, getting out faster, lower complications, and they do it in a very low cost model. And it's really exciting to see. And then the double console mechanism means that a surgeon who doesn't have robotic experience can sit down next to me, like Dr. Fakuri did from Barbados, and learn to do the operation by practicing on the simulation, seeing it. I can hand over controls back and forth. So, training is something that I really feel passionate about. I want the next generation of the surgeons who are in the Caribbean to sit down next to me and my other colleagues and train on this and take care of myself, my relatives, my loved ones down there in the region. You can see the president of the Caribbean College of Surgeons, Dr. Greenidge, is here and came to visit, see our program. And of course, we have lots of good conversations, and he challenges me about how this can be a future in the Caribbean, because it is not without its own challenges. And that's going to be probably the crux of this last half of the presentation. This is the other team, got Tobago represented, St. Lucia, and Philippines and India. And you can see that the UK really is built on a wealth of experience from people from all over the world. Current clinical applications, I've said prostate, urology, but like I said, gynecology. General surgery is interesting. They're using robotics as an emergency fashion for appendix removal, gallbladder removal. Some of you on the call who may be medically trained may sneer at that. Why use such a highly technical piece of equipment to do robotic appendicectomy? For me, you have to learn how to use this carefully and sensibly, and you don't use it on difficult cases only. You have to build your experience. That's what I say to you. Colorectal surgery to remove part of the colon cancer. We know that's on the rise with our diet, with our lack of exercise. It's going to need to be addressed from the beginning, obviously, so leading healthier lifestyles, but obviously for those who have, or unfortunately have colon cancer, robotic surgery has allowed you to have this with minimal problems. And I've mentioned chest, lung, and heart already. What are the benefits and the limitations? Well, the benefit is, like I said, complete control of bleeding quickly. You can see it fast. Blood transfusion risk is extremely low. And that's a good thing. And then patients getting out of bed the same night, letting them walk around, you know, it's good for their psyche. Yes, the limitations, cost, training everyone, the infrastructure to handle this, these all have to be considered. And I'm not going to shy away from that. I'm going to talk about it. But before I do, let me just tell you the vision. This Firefly technology has allowed us to see residual cancer. So if I make a cut on the prostate here, and I think I've got rid of it, I switch on a light and I can see there's a spot of cancer left. So this technology is still in development. But if I'm seeing residual cancer, that means I go back and I remove that little bit of cancer. And that means there's less chance of cancer coming back. And I think we can rely on our skills and the naked eye, but enhancing our vision with technology is the next frontier. I think it's amazing, underexplored, needs to be explored. And the people on this call, hopefully somebody there is going to discover the next relatable thing with it and cancer of interest using robotic vision. So what's the Caribbean reality? Small populations per island, separated by oceans. Resources limited. And then you hit that with a hurricane that really puts everyone on the back foot as they recover their economy. So most islands, what they produce, can it sustain their GDP? Is it just purely tourism? And then obviously you look at some of the bigger countries becoming more, the best word I suppose to say is that they're more pro-nationalistic and taking care of their own. And so the opportunity for patients to fly to US and UK require visas, more restrictions, financial restrictions, producing documents saying you have certain amounts of money so that you don't overstay. And they hold on to that money at the border of these big countries. I won't name them, but I do see that as being a challenge and keeping people in the Caribbean who may want to access advanced care outside. So what do? We bring that advanced care home. That will address the workforce challenges that we see. The recruiting of premier engineers, surgeons, AI writers, code writers. You know, we got to recruit people, but we also got to keep them, got to retain them, got to give something that's interesting to them to do, to change. And also we have to address the uneven access of care to every island. The experience of a patient in Trinidad or Barbados may be different from the patient in the Grenadines. And how do we allow them to access this care? You know, this is the realities that make the Caribbean so challenging to introduce advanced care, because every island, if you install something that's high net worth, how do you roll it out to the other smaller islands? And I think that's something that hopefully we'll get into at Q&A. Hope I'm doing okay for time. Is robotic surgery in the Caribbean a reality? or am I just speaking about science fiction and hoping that you'll join me on my journey of dreams? It's a reality because the first slide said it's happening in Guyana. It is happening. What I would say to you is I would expect some partnerships to be forged. I would expect a one Caribbean region approach and not to be separated by every country having a robotic surgery system. That makes no financial sense. But it has to be accessible to every citizen of an island, and that requires governments to step up. There should be a hub island or specialist island that hosts a robot, an agreement with the non-hub islands. And I think the models of robotics, particularly the Chinese and Indian models, make this a reality or a possibility. There was a model that came about in India, hub and spoke. You know, this super hospital, if you like to call it like that, was in the center, and it allowed the smaller hospitals in the periphery to travel to this central hospital and have care. In the Caribbean, that is very, very sensible, except there's no road to drive on and practically no boat to get to, so you have to fly. And I think, you know, the little outreach centers, outreach clinics are possible. I can go to, you know, a St. Vincent and do a clinic, but the major operating has to happen in one island. I think that approach has to happen. And similarly with the engineering specialists, if one of you start to, you know, produce a robotic system or help service one and maintain it, you know, you're not going to fly out to every island. You would hope that the robot is at one central place because you pool the specialists in one area, you learn from each other, and you are the center that teaches. But robotic surgery versus open surgery, there are benefits, there's costs and value. And this is a snapshot of a little bit of a case comparison. And if you looked at the first row, open surgery baseline costs, robotic surgery is probably 10 to 15% more cost. So that's a higher upfront cost. I appreciate that. But then the second row, the days saved in hospital robotic surgery is 1 to 2 days, more like 1 day. And that's an 80% reduction from the usual 5 days. And that's a cost savings right there. Blood loss is less. Transfusions is less. You know, transfusions, blood transfusions cost a lot of money. Processing patients' blood group, processing blood, that costs a lot of money. If I say to you, out of the 2,500 robotic surgeries I've been involved in, maybe, you know, 1 or 2 blood transfusions, that's a very different conversation and a different impact for a hospital. And the complications are less. That means you're coming back into hospital is a less chance, and readmission is a less chance. And that puts a much more kind of, you know, palatable approach for a hospital administrator or CEO. So yes, the baseline of open surgery is A, and robotic surgery is A plus premium costs. But then the savings that I've mentioned allow you to have a net saving overall of 20 to 30% if you look at not only the surgery, but you look at the aftercare and the results and the outcomes of surgery. That's where the value is. It's not on the day of operating. It's not when I finish stitching the skin. It's what happens after. For many patients, that's where the benefit lies. So consideration, should every country have a robot? I'd be interested in people's views. How do we define value for surgery? How do you define value for surgery? Is it just what happens in the operating room, or is it the after effects, the aftercare, and the accessibility to all people in the Caribbean? Because I would hate this to be only a cosmopolitan surgery for the very wealthy or the insured. It has to be sustainable. It has to be something that everyone can enjoy. And if you're going to be talking about telecommunication surgery, are you going to put a robotic system in every island for telecommunication surgery? Or are you going to scale it by inviting centralized processes, a hub to happen? That's a decision that I can't make. Only policymakers will have a discussion about that. But when I say a sustainable program, I mean surgeons can't just jump and play on it. You know, I refuse to believe that 2 years of fellowship training that I've done is going to be the same as someone who's gone on a course for 3 weeks. You know, outcomes matter. The patients who undergo surgery trust you. And doing robotic surgery is nothing to think it's a walk in the park. A lot of stuff can go wrong, even though it's meant to go right, if you don't go through the proper process of mentorship, courses, and training. And then maintenance and support. Is your engineer going to be able to remote log in if there's a problem? Do they have the support in the region? And then it can't be for one specialty. Like I said, it's not about the surgeon. It is about a whole ecosystem. You have to mix up the cases from gynecology, robotic surgery, general surgery. So we do a lot of simulation when we're training, a lot of simulation. Used to be on the computer simulating until my fingers got sore, until I actually went on to do surgery on a live patient. That's how it should be. So the future, new robotic platforms. The future is artificial intelligence, where perhaps the robot has a suggestion of an anatomy that looks abnormal, or a particular move or step that you did in the past. Would you like to try it again? I mean, this is something that is exciting to me. Autonomous, meaning they take over, is something that, is a bit controversial. I don't know how I feel about that, but that's a personal opinion. But certainly simulation is important. A rehearsal of the surgery. You don't want to rehearse the surgery while you're actually doing the surgery. Okay, there has to be a simulation. There has to be training. And certainly, you can approach universities to consider how they can roll out robotic surgery training. That's important. But mentorship is key. I've got very experienced colleagues who I still draw on for any questions on difficult cases. I record a lot of the surgeries. Mentorship doesn't end no matter how experienced you are. Mentorship is an ongoing process in every discipline. How much does a robotic surgery cost? I usually get this question, so I just put it out there for you. This was taken off of LinkedIn, so you can get it, and I'm happy for you to have some slides if you want. Intuitive is a more common workhorse, 1.8 to 2.5 million. I believe this is in US dollars. Then there's the older model. There's a real basic model of 0.8 million. And they actually liken it to, how many Volkswagens does this robot cost? So, 53 Volkswagens for a Da Vinci. Asensus, I've never used it, but it is a robotic model. Medtronic and Mantra are quite similar in that their arms are separated, so a big footprint, but they are cheaper. Mantra is 0.6 to 1.2, so 25 Volkswagens. Then Microport is a Chinese model, 0.8 to 1.5, 32 Volkswagens. So I think, these last three are probably going to change the game in terms of robotic accessibility in the Caribbean. So what are the opportunities? I think regional centers of excellence, similar to, how UE, I suppose, breaks itself up into certain areas for law, engineering, etc. Cross-border training, I believe that one country or island introducing robotics doesn't have to pioneer on their own. I welcome opportunities for collaboration on research, on training. I think it should be Caribbean-led, and it should be for a process to allow talent to return home, to stay home, to recruit more talent, to grow young surgeons into robotic surgeons for the future. Because it is complex how far apart we all are. And I wish, Curacao good luck in the upcoming World Cup. As one Caribbean region, I really hope that they do well. But you can see all these different islands. This is obviously the full picture, but we're all separated, but together we can be quite mighty when you look at the patient population and the talented pool that's together. And just to plug in, because it's Men's Health Month, prostate cancer, in the UK, the screening program was just for people with genetic abnormalities, not across the board, not for Black men who have a higher risk. We still have work to do in the UK where I practice, and certainly we've got a lot more work to do in the Caribbean. And you can just see the disparities of men presenting with late diagnosis. Interestingly, Scotland had the highest rate of patients diagnosed with metastatic cancer that spread. But you can see the prostate cancer rates. Guadeloupe, Martinique are the highest per age standardized rate, followed by Ireland and Barbados, St. Lucia. Yeah, so this is something that needs to be addressed. We can't just sit back and look at this and be satisfied. And the deaths highest in Zimbabwe, Barbados, Jamaica, Trinidad, top 10, a lot of Caribbean countries. So that's where I'm going to end. We like to, enjoy our EVs. We actually will be driven by them if we visit San Francisco. You trust them completely. Technology is part of your world. It can assess our blood vessels. We have nanoparticles being explored where they can track how people actually, live and breathe. We have robotic technology packing Amazon shelves on their own, putting people out the job. That's not what I am actually, promoting, but I do think we need to engage in technology in a sensible way. And my takeaways would be technology is not the transformation of healthcare. Innovation has to be beyond a fancy tool. It's about the capacity. It's about the team. It's about the engineers, the governments, the hospital CEOs, everyone coming and building themselves up to be better, because the Caribbean is in a real poised position now in 2026 to be part of its own destiny. If other countries are rejecting the citizens to access healthcare, then we build it. I really look forward to the discussions, and maybe I'll just leave that question for the audience. What should robotic assisted surgery look like in the next 9 years? And I'll stop there. And I'll just leave that slide as a placeholder.
Thank you. Thank you.